Great. Well, thank you so much. Happy to give this presentation today. My name's Josh Merson, physician assistant, working in academia and emergency medicine. Currently the past president and the legislative chair of MAPA. And today joining from the Charles Group. Kate, I'll let you introduce yourself.
Hi, yes, thanks, Josh. Happy to be here. Kate Worrell from Charles Group. I think I was here maybe last time, I can't remember, but I have joined before and thrilled to be here. Charles Glick and I at Charles Group have had the pleasure of working with MAPA on behalf of your legislative priorities for a while now, I think almost 10 years or so. So really happy to be here with Josh to talk about what we're working on and Jason today.
Great. So it's been a very interesting and a tough year. So can you hit next slide, please? So at the end of last year, we had a few bills that were at play. And unfortunately, at the end, as many of you know, those bills actually did not make it out of committee, out of conference due to essentially COVID, where a lot of our smaller bills did not actually make it out. So to give a quick overview of where we were and where things landed, we'll talk about the final 2020 update and those bills specifically. Before we do that, to make a little more sense of where things are and where these specific bills ended up stopping in the process, Kate, would you mind giving a quick overview of the general process of a bill in the Massachusetts legislature?
Yeah, absolutely. Thanks, Josh. So we are right now at the start, essentially, of a 2-year legislative session. So as Josh was referring to last session, that was the last 2-year session, which went 2019 to 2020, and now we're in the 21-22 legislative session. So in each session, it begins right around January, and then January of the odd years. And then bills, there's about, this year, I think it was 6,500 bills that were filed in the Massachusetts legislature. So ours are, often sort of 4 or 5 out of those over 6,000 that are filed. The bills, the process they take really quickly, high level, is that they're routed to a certain legislative committee. So often ours will go to the Public Health Committee, sometimes Mental Health when we're talking about something like the psychiatric, the Section 12 and Section 35 holds. And then they will be scheduled for a hearing before that committee. That really happens anytime between, say, this spring and next spring. So it's a really long process to get, as you can imagine, all 6,500, 6,000 bills heard before committees. It'll be even more interesting this year to see how that all unfolds, given that everything at this point, at least, is still virtual. So hearings at this point, for the foreseeable future, will probably be done over Zoom virtually, and then at some point return to being done back up at the State House. And then once a bill is heard in front of a committee, that's when we'll often call on, MAPA members to either help us submit testimony or sometimes even come up to Beacon Hill and sit in front of the committee. Again, this year, maybe virtually, but we'll be doing that again. And then it moves out of that committee. If we make our case well enough, it moves out of that committee favorably, and then it often goes to another committee, often the Ways and Means Committee, and then has to actually pass both chambers. So it has to then pass the House, it has to pass the Senate. Those versions have to often be reconciled, and then it goes up to the governor. So I think all of that to say it's a big process. There's a lot of bills filed, and it's a long process. So I know it can feel really, I think, frustrating when things don't get done. And I know Josh will expand a little bit, on these bills and what we saw happen last year. But I just wanted to throw that out there, as Josh said, as some context too.
Great. So we had an act relative to PA non-competes that was filed last legislative session. That one got stuck in third reading when COVID hit. So third reading essentially is just it's almost a waiting area before it's held in front of the House or Senate chambers. So that kind of got stuck there when COVID hit. And then the other one that we had was an act enabling PA psychiatric and substance abuse holds. As many of you know with this is the Section 12s and Section 35s. There was a lot of other issues surrounding Section 35s in the states. And I think part of the bill got held up in that specific area, as many other groups wanted to open up Section 35 legislation. This one, unfortunately, was sent to study. So it's a good and a bad thing. Essentially, that means that it wasn't going anywhere. However, it wasn't voted down. When it's voted down, it pretty much taking up next legislative session is not going to happen. So it just got sent to study, which is a nice way of saying that we're just going to let this rest for the rest of the year. And that happens September, sometime around there. So before COVID hit, we were actually being quite aggressive. We did a lot of work, multiple hearings that many members of the MAPA board were at the State House waiting for hours upon hours, taking off of work, trying to get some of these hearings and submitting written testimony. COVID hit, and I would say, 3 months where nothing was heard, maybe a bit longer. And then both chambers got stuck on some really large bills. I know many of you know the Patients First bill, which unfortunately we weren't included in that in a favorable way. That wasn't without trying and advocacy and lobbying and doing a lot of work around the State House. Unfortunately, with that specific bill and regarding our OTP, the optimal team practice and limited service clinic amendments, those amendments were withdrawn. They weren't for a lack of trying. A lot of that was related to political pressures regarding those that were trying to usher the bills through the House and Senate. There's a number of reasons why that can happen, but the sponsors of those amendments were asked to withdraw that bill to try to keep the Patients First Act in a very limited scope. So they really just focused on mainly telehealth. And as we know, the nurse practitioners in there did get full practice authority. However, that's not all bad news. Because of the amount of times that we were in the news, we had multiple publications in the State House news. I personally was on WBUR, both written and on radio. We were in Commonwealth Magazine as well, and did a lot of advocacy work throughout COVID. And a lot of the legislators are starting to notice and realize that, PAs need to be included across the board. Even PAs with national news is one of the coolest things that I've seen with the PA that's going to be going to space soon. So we're seeing PAs at the national level, which is really great, and that's really helping us at the state level as well. So at the end of the session, both chambers passed a few big bills. One of them was actually the Roe Act, where PAs were actually included in that, which allowed PAs to authorize and perform abortions in the Commonwealth of Massachusetts, which was a great win for PAs to be included in that. So last legislative session, which was 2019 to 2020, really spilled over to 2020, 2021. So there's a very limited time for us trying to finish and be included in any bills there to actually continue to file our next bills and their session that started just a few weeks ago. Next slide, please. So I know that's pretty small, but many of you have already seen this through email as we sent out the advocacy alerts, letting all of you know about all of these bills that we were able to file. The non-competes, that was a refile, the same exact language that we had before, with different Senate filer, but John Santiago, many of you know him, he's a emergency department of physician at Boston Medical Center as well, and actually running for Boston mayor right now. So he was glad to file this for us. And we did actually file authorizing psychiatric holds as well, but that we're only focusing on Section 12s, and we thought it was best politically to avoid the Section 35s, which are those 30-day substance abuse holds. So we'll see where that goes. And we took our amendments that we filed last session and put those into outright bills. So an act relative to removing barriers to care for PAs. This is really where we're going to spend a lot of our time and effort as much as possible. Really, the goal of this is to remove the state requirement to file a supervising physician. So that paperwork they have to file every single year, that will be removing that on top of a number of different other areas once you take a look at the bill if you wanted to dig down further. And then we're also filing the limited service clinics, which would allow PAs to actually work at pretty much the only limited service clinic in Massachusetts is CVS MinuteClinic. And that's relative to a definition of the limited service clinic, which actually only includes nurse practitioners. So it's a fairly simple short bill, just adding us to the definition of limited service clinics. So to take what Kate was discussing about before, this is going to be a fairly long process, though we are going to try to push to bring this in front of committee and to move it out of committee as soon as possible, because many of these things are COVID related and would actually improve access in many, many areas across the state.
Yeah, and Josh, I would just add that, you know, as you mentioned, and not surprisingly, COVID really did throw a huge wrench into, you know, so many things in life. But in terms of the legislature, they really did sort of halt activity last year. I mean, they couldn't even, you know, logistically figure out how to meet. They had 200 members, and they were trying to figure out how to take up the state budget remotely. So as Josh said, at the end of the day, they did a couple big bills, but there really was probably, you know, about a year where honestly there was a handful of bills that went through. So I think, you know, what we were just starting to talk about pre-COVID was honestly starting to take a more, I would say sort of assertive / aggressive, I don't like to use that word, but approach to our advocacy. I think we've always been careful, and MAPA's had really good relationships that we've built over a long time with the Mass Medical Society and with legislators. And I think we've done all that the right way. But I think especially in light of the nurse practitioner piece moving forward, as Josh said, and a lot of other things we feel have aligned, I think it's really our time, in our opinion, to start pushing a little bit harder than we have been. And so to that end, we'll be doing some more, I think, meeting and talking with folks at the Mass Medical Society, some of the other groups that we have not focused on as much historically, to really start using, you know, this sort of post-COVID time to really push some of these bills forward. Because I think, as Josh said, the COVID has really shown why many of these are truly needed. And we saw that through the executive order and through a lot of the things that I think paved the way now for us to come out a little bit more assertively on these issues.
And please, if you have any questions, please put them in the chat and we'll be glad to answer those. Yeah, it's been an interesting year. Our goal really is to be as aggressive as possible. And I will say to everyone that's on here, we are going to need your help. Frequently, it's a very slim amount of people that come to the State House, actually submit written testimony, or even call or email their states, senators and representatives. This is something that we really need all hands on deck. We need members to continue to really make these contacts, be a member of MAPA, so we can actually hire groups such as the Charles Group to continue to advocate for us and lobby for us in the State House. So when we send out emails, again, please feel free to email us back if you have any questions. I know many of the board is willing to get on the phone and talk with you. Let us know, kind of let you know where our efforts are. But we really could actually use, thank you, Kathy, could use everyone's help in trying to advance these forward. Like I said, in the past few weeks, our advocacy efforts have been related to developing co-sponsorships. And I think as things move throughout different committees in the hearing process, as Kate said, we'll be reaching out to other groups that could possibly be supportive of us across the board. And we will send out email updates with any of those that may happen.
Yeah, and to what you just said, Josh, and what Kathy, thank you, Kathy, for doing that, said in the chat, I think, you know, it is really useful to have multiple and varied voices reaching out to folks. So, you know, it's great for me, for Josh, for Sarah, for Jason, you know, to be having some of these conversations and doing these meetings. But then it's really meaningful when that's done in conjunction with, you know, Rep Campbell hearing directly from Kathy, or, you know, I know Sarah Christie had reached out to her, to Rep Garbely, and got a response directly from him. So it's really, they respond very differently, not surprisingly, to constituents. And that's, you know, very important to many of them. So you can really, yeah, as Kathy said, I was going to say, we can make sure it's really simple for you. So copying, pasting, you know, especially right now, people are not working up at the State House. So it's really just emails. And so you're really just making sure you're getting this in front of them. But if they're hearing from their constituents that are PAs, that these bills are important, That's great. And co-sponsorship is still open. So all that means to be a co-sponsor, the rep or the senator literally just adds their name as a supporter onto any of these bills. And it's meaningful. You know, I was just looking right before we came on our removing barriers to care, sort of our big bill that Rep. Barber filed in the House, Christine Barber of Somerville. So as of right now, I think there's 14 people who have signed on to that as co-sponsors. So that's pretty meaningful when you look at the bill and you see, okay, so she filed this, but then there's a whole nother 15 that signed on and are saying they support it. And then what that allows us to do too is not only have they put their name, but then when it comes time for the hearing or for other things, it gives us the ability to go back to someone like Rep. Campbell, Rep. Garbley, whoever, and say, hey, you added your name to this. Now we'd like you to submit testimony and support, or we'd ask you to do X. So it just allows us to show that this is not an issue that just a small set of people care about, but an issue that impacts, all the reps and senators and PAs across the Commonwealth too, and patients.
Great. I'm gonna give a quick shout out to the rest of our legislative board. Sarah Christie has been involved a long time and really helping us out a lot. She's led the legislative committee really last 5-6 years, Sarah, I think around there. Duncan DeVoe, our current treasurer, I probably said his last name wrong. He's been actively involved, really making a lot of phone calls, coming to the State House, driving 2 hours just to be at some of these meetings. Cole Turno has been present, our current president-elect. Jason Parenti has been actively involved. So thank you everyone from the executive board and the director at large as well for being involved and helping us out with a lot of these legislative efforts.
Sorry, Josh, the only other thing I would quickly add, oh, and I see Megan said there's a question too. I was just going to say, I know it can feel discouraging too to see what moved forward for the nurse practitioners, or, I'll say at least for me, it feels discouraging often. But I think we really do see that as a positive in that there continues to be, I think, a lot of education to be done around PAs and Josh and Jason, I think you were there too. I remember just right before COVID, sitting in Senator Chandler's office, actually around her table and talking about doing a briefing up at the State House to really educate legislators and their staff on PAs and what you're doing across the state, because we were saying that that's still a gap that exists. So, all of that to say, I think having the nurse practitioners piece go through in many ways really opens the door now for us to say, okay, it's our turn now. And we're going to seek to get, our own legislation, our own, allowing us to practice really at the top of our license passed as well. So I would just note that too.
Great. Kate, could you look up to see if Brian Murray is a co-sponsor for that Q&A in the chat?
Yes, let me take a look.
Great, and I'm going to pull the person that just for JAP GPAC. Great, I will open up an email right now and put your name in so I can contact you. Joan, thank you so much. I will email you right now so you have my contact information, and we'll reach out and we can absolutely use your help. And yes, Kathy, Utah just had a big victory this week, which is great to hear that more and more states are actually adding optimal team practice and allowing PAs to actually work at their full knowledge and licensure. So that was great.
And I don't think from our end that that Rep. Brian Murray is on the bills yet, but we can follow up with him also from our end.
Great. And Kate, have you heard anything new with telehealth in Massachusetts?
I haven't. That's a really good question. It's something that they definitely kept, they kept talking about as something. It's been talked about pre-COVID, and then obviously, really, I think one of those things that came to light a lot with COVID, not surprisingly. But I haven't heard any more rumblings around that. But let me see if we can find out a little bit more of what's happening on that front. We can report back. And the one other thing I would add to that reminded me of also is that we anticipate that there will be some COVID relief kind of omnibus bills coming through in the coming months, as there were, one or two last year. And so Josh and I have talked, and those will be bills too that we'll be seeking to try to find any openings to, get any of the language of these bills included in those as well. So that's just another potential way to move some of this forward is the individual bills, but then also, obviously these can be packaged and can be, not even packaged, I should say, they can be seen as COVID relief measures important to our recovery. So that's another option that we have in terms of trying to move them forward.
I will say, Joan, that's exactly the point, that if you want to work in a COVID vaccine clinic, we want you to be able to work at CVS Minute Clinic in order to give the COVID vaccine, but not have to file a brand new paperwork with the state, filing a supervising physician. It's absolutely one of our talking points. And it just doesn't make sense anymore to have to file this paperwork and have all of that language and our relationship with anyone else be determined at the specific practice. And from Deb, are PAs able to do telehealth right now? Yes, they are. I am not a master at telehealth. I know Sarah Christie has been doing more, but PAs have been actively doing telehealth throughout the entire pandemic. The issue really has been when you were crossing state lines. So if a patient comes to, like I work at Brigham and Women's, if a patient works just over the border at like Southern New Hampshire somewhere, technically you're practicing outside state boundaries, and that isn't allowed. So that's where a lot of the talk is, allowing reciprocity in different states to be able to provide telehealth services, since our location is within the state. I think I said that appropriately, Kate and Sarah.
No, I think that's perfect. Yep.
Great, I'll give it one more minute if we have any other questions. Yeah, Deb, as of right now, that's what we're seeing in regarding to opening up their own practice. I'll be honest, it's still going to be a little bit tough as a PA to open up their own practice. One of the unfortunate things in the bill is politically, because of a few specific reps actually asking that did not want PAs to be able to open up their own practice. So that is something that we're going to be looking at and seeing if we can amend throughout the process. Okay, so Massachusetts. So the goal, I don't think we've ever called it licensed independent practitioners. I think that's what you mean by the LIPs. The goal really is to remove the state requirement for a supervising physician. That's really, it's that paperwork and removing like our license that's attached to an SP. So it is, we're not outright saying licensed independent practitioner. That's not the goal. It's really the goal of optimal team practice is to remove that state's regulatory requirements for that relationship to occur with another provider.
Yeah, and I would just add too that we, in addition to filing that bill, what Josh just said, that we have had good conversations over the years, really, with the Department of Public Health and with others in the administration. So they've been really good supporters of PAs and of the work that you all are doing. I think there's a couple folks over there in particular that really understand the PA profession and want to be helpful to the extent that they can. So we're continuing to have those conversations with DPH, with BORPA and others. And, Sarah and Josh and others have really cultivated really strong relationships over there over the years that have been very helpful too.
Great. Yeah, I would say our advocacy efforts that we actually were able to coalesce every PA school in Massachusetts to work with DPH and just adding PA students to the list of eligible COVID vaccinators. we ended up expanding the pool of potential vaccinators even more broadly to include dental hygienists, veterinarians, I think were on there. So it has been great. So MCSR. So that's a little bit of a different issue. The MCSR requirements for the supervising physician, they're basing it off of what the statutory requirement is right now. So we believe the regulatory information and the requirements would hopefully change if we're able to change the statutory or the legislative association with the SB. So our hope is to not have that MCSR tied to the supervising physician, allowing us to actually just have that MCSR and additionally, hopefully not have to apply for it every single year and hopefully move that to a little bit extended timeline. But the DPH guidelines right now are tied to what we're doing in the State House. So hopefully one will end up leading towards the other. Great, and thank you, Debbie, for the additional information on telehealth with OBGYN practice. From Deb, will we still need prescribing guidelines? I assume you meant with a supervising physician. That, again, if we're able to remove that relationship with the supervising physician, that would remove the prescribing guidelines that we have to sign and fill out yearly. Let's see, PAs in the Q&A. Did you say PAs are not supposed to be doing telehealth out of state? If so, there's any way to send some information offline to bring to my team. So, Kate, correct me if I'm wrong, but part of the emergency order was allowing PAs to have that reciprocity just when the emergency order ends.
I think that's correct. Yeah.
Yeah, so the goal is that with the telehealth bill that we're able to continue that reciprocity to practice beyond state lines after the emergency order that is currently in place ends through what Governor Baker initially signed. So it's still in place. We don't have a specific end date right now, as far as I heard, but that changes every single day. So I'll let you know more information on that. I apologize if I didn't specify that it was directly related to the emergency order over state lines. It's more just making that permanence versus ending with the emergency order. So physician associates, I'm going to completely defer that. That is the HOD and AAPA discussion, though MAPA is handling it within the states. But I'm going to defer that to the HOD and some of the other AAPA discussion. The other question, can PAs independently order home health services? Kate, I haven't looked at this in a while.
I don't know the answer to that off the top of my head, but we can find out and get back.
Amber, if you could actually just email info@mass-pa.com and we'll follow up with you directly. I haven't looked at this, I think, since COVID started. So if you could just email us and we'll double check the answer.
I received a few questions about asking if it's too late to still email your senators or representatives regarding all of these initiatives.
No, it's not too late. It's a good question. There used to be a deadline of 2 weeks after filing, which they actually got rid of completely this year in both chambers. So the bills were all filed on February 19th, and essentially there's no deadline. The deadline is when the bills reported out of committee, which is like a year from now. So no, please, if you haven't done that and are still able to, that would be fantastic. The more we can keep adding people on, the better.
Great. Jason, do you have anything else to add?
No, thank you both very much. We appreciate the updates. It certainly has been a busy year, and I look forward to keeping the momentum going. So thank you both. I think we just have a couple of slides in closing when we switch over. And this is the important stuff, so stay tuned. And then after this, we'll host the annual meeting, which should be relatively brief, but you're welcome to attend. So just to clarify, you should have already received an email, or if you have not, you will shortly. To get CME, there are actually two separate surveys. So one is for the scope of pain certificate, and one is for the remainder of the CME. So the scope of pain is a separate certificate, which you will get essentially immediately after completing the quiz and scoring at least 70%. And the other certificate you will receive within 2 weeks from the conference after completing the survey. If you have not received it by April 5th, please call or email us. And that's really about it. I think we can close it up here unless anyone has anything else. I want to thank McKenna Management again for all their help, and I want to specifically thank Tia Phillips and Thea Nolan for their hard work in putting together such a fantastic conference. It was a long day, but it was a full day, and I appreciate everyone joining us. So feel free to stick around if you'd like to join the annual meeting. Otherwise, enjoy this beautiful weather. Oh yeah, one more thing, the save the date, the fall conference will be on October 23rd. It has not been formally decided whether it will be virtual or in person, although we're motivated to have it in person if allowed based on current guidelines. But save the date, and there'll be the Challenge Bowl simultaneously in October following the conference. And that's it. Thank you again to all of our sponsors and everybody who made today a great success.